Dr. Emily Hayes, an animal shelter veterinarian, has a new patient.
Hi, buddy.
A cat by the name of Bean Dip. She gives him a standard veterinary exam to figure out his needs so he can become an ideal adoption candidate for someone. And two problems she immediately notices are his teeth and
Don't sneeze.
a possible respiratory infection. Fortunately, issues like these are more likely to be treated thanks to advances in shelter medicine in recent decades, including those made possible by Morris Animal Foundation.
Just knowing now that shelter medicine is a term and it's a thing is pretty amazing. I think if a lot of people go back, 20 years, it was a pound and there wasn't a lot of medicine maybe being practiced.
Every year, more than 6 million cats and dogs enter shelters. 3.2 million are adopted, but another 3 million are euthanized. Morris Animal Foundation has invested more than $9 million towards shelter medicine studies to improve the animals' quality of life and increase their chances of finding their forever homes.
We recognize these are very vulnerable animals and they deserve our attention and expertise.
Primarily, those studies focus on overpopulation, housing and enrichment programs, and infectious diseases, like canine influenza, which can cause pain, suffering, and even death in some dogs. It's transmitted by coughing and sneezing, making it easy to spread between animals in close contact. Dogs housed in groups, like at animal shelters, are at the highest risk for infection. Foundation-funded researchers at Colorado State University studied the disease at 6 different shelters in different states to examine their infection rates.
One of the parts of our goal was to help these dogs in terms of finding out, are there better ways to control some of these infectious diseases within the shelter environment?
Among their findings was that many dogs actually enter shelters with the infection, meaning it's already circulating in outside populations, and the dogs are helping it persist within shelters. To cut down on transmissions, the team recommended dogs get quarantined upon admission and co-housing with other dogs be limited. A vaccine for canine influenza exists, but it's expensive and only effective against a few strains. Foundation-funded researchers at the University of Georgia are currently helping develop a new vaccine that's cheaper and more effective. Another common infectious disease problem is feline upper respiratory infections. These resemble a common cold in humans, with symptoms like sneezing, nasal congestion, and discharge from the eyes. In cats, though, these infections are often caused by feline herpes virus type 1, and because of that, often emerge during times of stress. A substantial number of cats develop infections within 2 weeks of coming to a shelter, and many shelters invest a third of their resources dealing with it. Foundation-funded researchers at the University of California, Davis worked with 9 shelters around North America over a year to find risk factors. They discovered 2 surprisingly simple solutions that were immediately actionable. Doubling a cat's floor space from the common average of 4 square feet to 8, and providing it with 2 separate compartments to separate the litter box from food, water, and a bed, made a 50-fold difference in the risk of infection.
It can be done for as little as $100 per cage, and shelters will save that easily in the first few months. Just treating a couple cats for upper respiratory infection could easily cost that much.
They even designed a plastic sleeve to join 2 smaller cages together. Hurley says fewer sick cats not only freed up more staff time, but saw adoption rates rise and euthanasia rates drop, sometimes dramatically. Wherever an animal lives, in a shelter or in our homes, Morris Animal Foundation wants to fund the best science to improve the health and well-being of animals everywhere. But we need your help to do it. Please make a gift today at morrisanimalfoundation.org.